Unfortunately, many of our residents are affected directly or indirectly by drug and alcohol misuse. Alcohol-related death rate has also been rising in recent years, with the latest data of 2022 showing alcohol-related mortality among males in Havering as being 57 per 100,000 of the population, and it was higher than the London average of 51 per 100,000. The drug strategy commits to promoting equality and meeting the needs of all the vulnerable communities. The successful implementation of this 5-year strategy will be dependent on the whole local partnership working together and showing responsibility for creating a safer, healthier and more productive society.
Our strategy was drafted in response to UK Government's national policy. In our new strategy, partners in Havering will work together to break drug supply chains, deliver a world-class treatment and recovery system, achieve a generational shift in demand for drugs, and reduce the risk and harm to individuals, families and communities. A plan to address these 4 key areas was developed through working with all key stakeholders, including the NHS, drug and alcohol treatment services, voluntary care sector, schools, police, trading standards, licensing, the Department for Work and Pensions, and Children's and Adult Social Care Services.
Project ADDA is a Metropolitan Police-wide team working with local communities, businesses and services to tackle drug misuse. We're doing that through intervention, education, getting more people into treatment, as well as enforcement to break the drug supply chains. Drugs and addiction plays a part in over half of all acquisitive crimes, such as burglaries, thefts, robberies and car crime. It's linked to murders and violent crime in our communities. It also leads to family breakdowns and overstretched public services. We can't just arrest our way out of this situation. We need to work with communities and services to turn around the lives of those impacted by drugs. Getting more people into treatment to break the cycle of addiction leads to less crime in our neighbourhoods.
Here in Havering, we're working as part of a multi-agency team tackling substance misuse head-on. We're increasing our drug testing in our custodies, diverting more offenders away from criminality and into recovery. We are targeting persistent offenders who bring misery to our communities by increasing our use of criminal behaviour orders. These court orders prohibit specified criminal behaviours and require offenders to engage with treatment services. They provide long-term relief to our communities and businesses. We are working alongside our local and specialist police teams, disrupting criminals who prey on our community and vulnerable people. We also need the public's help. If you identify issues surrounding drugs, please speak to your local police team.
Change Grow Live delivers the drug and alcohol treatment recovery service for adults and young people here in Havering. We deliver a world-class treatment recovery service. These include end-to-end recovery plans, clinical interventions, group work and counselling services. All of these services are delivered from our hub as well as various sites in Havering. These include Queen's and Goodmates Hospital, Magistrates Probation Service, police stations and also hostels. Our success is highlighted in our recent KPIs. Some of these include successful completion in treatment, numbers in treatment, and also people who are released from prison engaging in the community. In all of these areas, we are performing above London average and also some areas above national average. We also recently set up a joint working with NELF, and we are talking about complex cases and how we support them in the community. We also recently won the individual placement service contract. This includes managing the tri-borough, which is Redbridge, Barking and Dagenham and Havering. This drug strategy helps us improve the services we're already delivering, but at the same time delivers the message to the residents of Havering on the services that are currently on offer.
I think teaching children in schools about drugs and alcohol awareness at an earlier age, such as age 11, is really important because sometimes there is peer pressure and they don't know where to go and who to talk to. I think it would be helpful to speak to people with past experience to show the effects that it can have, not only on yourself but on your family and all your relationships, and how it can affect your future. We did have one instance when someone came to my school and showed how devastating the effects can be. Having someone young people can relate to and speak to confidentially if you are struggling with the temptation of drugs or other issues is a must. Assemblies don't work, so schools need to ask us how they can help and support young people.
For individuals who struggle with substance misuse, there is often a sense of shame and stigma that extends to family and friends. Providing effective safeguarding support for those affected by substance misuse is key to ensuring that everyone, those who use, those who are in recovery and their families, are supported. As Chair of the Safeguarding Adults Board and the Safeguarding Children's Partnership in Havering, I am delighted to support the launch of this strategy, which will help provide some of this extra support. There is strength in multi-agency working together and training together to help support our communities, and we want everyone to think family and to consider all those affected. Multi-agency training is a great way to build our response in Havering, and you can find more information about this training at the end of this video.